Dr. Kaseya, thank you so much for joining us right now. Can you just explain to our audience why this virus is spreading so quickly right now?
Thank you so much for having me. There are so many reasons. The first one is we didn't detect that early enough. And we know from some studies that this outbreak started around February, but we declared that in May. The second reason is the insecurity in this region with so many rebels. The third reason is the humanitarian context. And the fourth one, we didn't manage to bring the response at community level. And for all of these reasons, we can see the consequence today. But what is important is the decision that we make to move forward and to stop that.
I'm just wondering, because as we reported coming into this segment, that this disease is spreading right now at a rate faster than the last outbreak that we covered about 10 years ago. So what lessons, if any, were learned and clearly not implemented following that outbreak this time around?
I think there is no single failure and no single institution to blame today. But there are lessons we must confront. First, as we said, when we didn't identify this outbreak early enough, there are consequences. What are we doing now? We are bringing back now the response at community level. And I want to thank President Tshisekedi. When I met him on the 5th of August, we agree on that. We are bringing also all tools that we have, like remdesivir, that is this medicine that the US with Gilead, they are manufacturing. We are also bringing some lessons we have from vaccine. I'm so confident now that with actions that we are conducting, we can think to stop this outbreak very soon.
This particular strain is the Bundibugyo species of Ebola, and there hasn't been a vaccine developed yet for this particular strain that's proved to be so lethal. How close are we to a vaccine?
You know, vaccination is an important part of our response, but we must also be scientifically precise. Bundibugyo is not the same virus for which our existing Zaire Ebola vaccine we have. But the context is different, but we need also to ask the most important question is, why should the continent of 1.45 billion people must continue to find itself waiting for life-saving medical product coming from Western countries? I think this is the question that even created this mistrust between communities, health workers, and the leaders. And currently, we are conducting some clinical trials, but we are clear on that. We need to manufacture this product from Africa, for Africans, and that will help us for the future.
Yeah, trust is so important, because even if a vaccine exists, there's the question of distribution, and then there's the question of people willing to take the vaccine. There are a number of factors and consequences, as you've noted, in leading to the death toll that we're seeing in this particular outbreak. Nearly 1 in every 2 confirmed cases is now fatal. In some 5,000 confirmed cases have been reported, deaths surpassing, as we noted, the last outbreak. It's all coming as the U.S. Over the last year and a half has withdrawn USAID. You mentioned sort of a lack of urgency from the global community. What role is that playing right now, specifically from the United States?
You know, I'm not blaming, as Director-General Africa, I'm not just blaming one country. I'm blaming first our own African leaders. They didn't invest enough to their health systems. Now, I can tell you, I come from the SADC meeting, the Southern African Development Community in South Africa. I see how leaders are saying they are investing now in their system. The second blame, it's all our partners. mostly all of them, they decided to cut money to Africa. But the issue is they decided to cut this money suddenly. They didn't even give us some time to say, get ready. And it's a major lesson, but for me, it's also an opportunity. Like for this Ebola outbreak, before going to Western countries, I started in Africa. We got $110 million from Africa without going to partners. I think this is the sovereignty I'm talking about on a daily basis. And this is also is making us respected. I want to say thank you to the US. They contributed around $400 million to this Ebola outbreak and other partners. But the main question is to whom they are giving this money. Are we sure that this money is going to the field? This is the conversation that we're having with the US colleagues.
We can't be having it more forcefully enough. Time is of the essence here. People's lives are at stake. Dr. Kaseya, thank you so much for joining us. We really appreciate it.